Hi, I saw your video and I thought I'd do a response to it because it raises some interesting points, and I thought a UK perspective of what's going on, because we have a National Health Service, so some of the issues you report don't happen in the UK, but there are obviously some that still do, i.e. the high death rate amongst black women is much higher than white women and mixed race women and Asian women. It was one hospital in the UK. There was a scandal because they were falsifying records to show that they were giving good maternity care, and they had a philosophy of natural birth, vaginal birth only, and it was rubbish, and the death rate was very high. Predominantly white area, but they were still having a very high death rate because they were focusing on natural birth. Now, the issue is that statistically, a caesarean section is far safer for a black woman than natural birth. Now, no one dares mention that. I just wondered what your thoughts on that were. I also know that Joe Cervical Trust, Joe was a celebrity in the UK that died of cervical cancer. Now, she actually had previous treatment before and wouldn't go for any more because she found it so traumatic. She'd had a lease, but there was a trust set up in her name, and they did a survey and found that BAME, Black Asian minority ethnic women, had a far greater issue with seeing, percentage-wise, issue with seeing male gynecologists, far greater. In fact, where I used to work in a hospital, in the kitchen, many women from, I think she was from Ethiopia actually, but I worked from women from Kenya and all over the African continent. In fact, this particular woman was offended, not just upset, but really offended and upset that a man offered to do an intimate examination, and she was like, just go and get me a woman. So accessing females is a big issue. But one point I found quite interesting, you mentioned about fibroids being more common amongst black women. Well, we have an issue here with outpatient procedures, outpatient hysteroscopy, but it's increased greatly with procedures like MyoSure or TrueClear. Very painful. I've seen the pain scores, and Medtronic actually told me, they said clinically there's no reason for anaesthesia, which is utter rubbish. You need anaesthesia for that size of scope. And the problem here in the UK, the RCOG, our version of the ACOG, is we have no guidelines for operative hysteroscopy. Diagnostic, yes, but not operative. Now, they say most women tolerate it well. No. From the pain scores, most women don't tolerate it well. And I don't know whether you give sedation or propofol. I do know it varies hugely across America. I do know one woman, you probably know her, Migs. She said, I probed her and asked her, and eventually she did admit that because of insurance, every now and then when she gets someone who finds an outpatient diagnostic or operative, but even diagnostic hysteroscopy painful, insurance-wise, she has no choice but to carry on. So every now and then she absolutely tortures a woman because you can't have the insurance-wise the anaesthesia. Well, here in the UK, it's done simply to save money. They actually have a legal right to a GA and other pain relief, but not everybody knows that. Very few know that, and very few hospitals say that, or if they do offer a GA, or never really hear of much other pain relief, but if they do offer a GA, sometimes they say, oh, there's no need for it, it's just uncomfortable. And again, see, the ablation, the NovoSure, one pain survey showed that 91% found it, only 9% found it pain-free. Most women found it painful, and most women found it horrendously painful. So here in the UK, there is an issue in gynaecology, full stop, of women not being given effective pain relief for these kind of procedures. You know, cervical biopsies without locals. It goes on and on and on. I just would like your thoughts on that, and if you could tell me what your protocols are and what happens if someone's finding it very painful and there's just no alternative insurance wise. You just gotta, I just would like to know where you stand on this. Thanks, bye.